Hi, my name is Dr. Amir. A lot of people still have some doubts and concerns about taking the COVID-19 vaccine. So far, over 150 million have taken the vaccine around the world. Here in the UAE, due to our outstanding government management, over 45% of the population have been vaccinated as well. Obviously, this is very good news. But I have been receiving a lot of questions about these vaccines. So I will answer some of them in this video to clarify and remove these doubts. Regarding myself, I have recently received my second vaccine shot. A lot of people were asking me about how I am feeling and what were the side effects. As expected, I had a slight pain at the site of the injection. The next day, I had a very slight fever with fatigue and some muscle aches. But everything went back to normal the following day. These side effects were mild because I was taking paracetamol and alternating it with ibuprofen every 6 hours. Of course, these side effects can be stronger in certain people, especially after the second shot. I want you to know that we really don't know how long the immunity will last after taking the vaccine. It is possible you might require to take it every year, like the influenza vaccine. Also, we don't know if all these vaccines will cover the new mutation of the virus. First question: do I need to take the vaccine if I had COVID-19 infection before? The disease does not give you good immunity for a long time. It is estimated to be from 3 to 6 months, depending on the severity of your illness. You can do a blood test to check the presence of the antibodies, which means immunity. We have few patients who had the COVID-19 infection twice, so it is expected you get a better immunity after taking the vaccine. Next question: when can I take the vaccine after I recover from COVID-19? Ideally, if you recover and currently without any symptoms, and you tested positive 2 or 3 weeks earlier, you can take it. But in real life, and because of the priority to vaccinate the high-risk patient first, you might get delayed for 3 months. Another question: I am afraid from taking the vaccine because it will make me sick. All of the COVID-19 vaccines will not make you sick because they don't contain any live version of the virus. But of course, COVID-19 vaccine, like the flu shots or other vaccine, may sometimes cause some side effects, like low-grade fever, fatigue, headaches, and body aches in the first 3 days after taking the vaccine. Most of the time, these side effects are related to the response from the immune system toward the vaccine. But you should be careful after taking the first dose of the vaccine not to catch the COVID-19 infection, as you don't develop good immunity after the first shot. This means that it is possible you can be in the incubation period and you don't have any symptoms by the time when you are taking the vaccine. Then a few days later, you start having COVID-19 symptoms, so the infection for sure is not from the vaccine. Someone asked, how can we differentiate if we have some symptoms after taking the vaccine, whether these are from the side effects or it is from COVID-19 infection? Actually, the side effects happen only for the first 3 days after taking the vaccine, and they will disappear after that. But if the symptoms persist after that time, or if they are getting worse, then it is better for you to get tested by doing a PCR test. Next question: if I have high blood pressure or diabetes, will the vaccine harm my body and worsen my condition? In fact, these chronic diseases will make you at a higher risk of getting serious COVID-19 infection. So for this reason, these patients should get vaccinated first, and it will not affect their blood pressure or glucose readings. Lots of patients were asking, can they take the vaccine if they have drug allergies like penicillin or aspirin, or even certain food allergies like eggs? In general, these allergies might be of concern for people who have severe life-threatening allergy like anaphylaxis. So they should consult their doctor before taking any vaccine. But for mild allergies, like rash and swelling, they can take the vaccine, but they need to be observed for half an hour after the shot and treated with antihistamine if needed. Next question. Can I take the vaccine if I am sick? No, it's better to take it when you are healthy without any symptoms, especially fever. Also, it is not a bad idea to do a PCR test before taking the vaccine if you have any symptoms, to make sure you don't have COVID-19 at that time. The next question, does the vaccine cause infertility? In fact, according to the Pfizer study, 23 women who were involved in the study became pregnant after taking the vaccine, which means the vaccine doesn't cause infertility. There was only one woman who suffered a pregnancy loss. Actually, she had the placebo and not the actual vaccine. Several patients asked me if it is safe to take the vaccine if they have a prior history of serious medical conditions like breast cancer, autoimmune diseases, or patients with heart attacks who are taking blood thinners. Always, you should consult your doctor before taking any vaccine. But in general, it is safe to take the vaccine for those patients because they are considered at high risk for getting a COVID-19 infection. Another question, the vaccine is very dangerous. That is why it's not given to pregnant women. That statement is not true. In fact, most medical studies don't include any pregnant women in their studies because it is not ethical to experiment on them. Also, this is the same reason for not giving the vaccine to women who are breastfeeding. Last question, will the vaccine cause my PCR test to be positive? Taking the COVID-19 vaccine will not result in a false positive PCR test because the swab for this test can detect only the RNA particles of the COVID-19 virus in the back of the nose. Most of the vaccine, except the Chinese one, don't have any part of the COVID-19 virus. Anyway, after injecting any vaccine into the body, there are no RNA particles of the virus present in the nose. Finally, I hope I clarified some of the doubts and concerns that you may have had about the COVID-19 vaccines. If you like my video, please share it with your friends and subscribe to my YouTube channel. Until I see you again, I would like to wish you a happy, healthy life.